I'm going to give everybody a moment to pop back on here. Great. And then I'm getting some questions that are coming through. There is one that I want to start with real quick that talks about how, Kabuki syndrome, we have type 1 and we have type 2. And for example, in this one, females with KDM6A or type 2 can be less affected. Is it useful to include us in research? 100% yes, yes, yes. My daughter also has Kabuki syndrome type 2. Maybe she is more mildly effective than some of the other people here, but we know that Kabuki syndrome occurs on a spectrum, and we know that there are differences between those types. But if we can define those differences, we can give people more information. We can further define the treatments that are most appropriate for them. And like the clinical management guidelines, for example, maybe things will be different for type 1 than they are for type 2, but the only way we can know that is if everybody participates. It's so important that if you're here today, no matter what type you have, what severity you think you have, please do participate in any of these research studies that you're eligible for. Just wanted to top that one off to get us started, guys. Thank you for asking that question, Sabine. All right, I'm going to start with questions on KSOC a bit here. The first one that I would like to ask is to Dr. Simpson. Are you scheduling clinic visits at St. Jude for people who don't qualify necessarily to participate in KSOC?
Great question. We are still finalizing recruitment, and it will depend on your geographic area. So we hope to welcome everyone, but it may be that those that are eligible for KSOC may be able to come from a larger geographic area, and then those within our regular encatchment area would be able to come if not eligible. But maybe eventually we can have all comers. But for now, given the newness, we're kind of have those parameters. Great question.
Thank you, Dr. Simpson. This next one is for Dr. Tang. Can international families participate in KSOC?
Yes, as long as the person with Kabuki syndrome is proficient in English, then they can participate. We'll welcome everyone who can speak English to join.
Perfect. And is KSF covering the lodging as well as the travel for patients and families who are able to travel for KSOC?
Yes, we are covering all travel expenses for the person with Kabuki syndrome and a support person to travel to participate in the KSOC appointment.
Perfect. Thank you. I think this next question could be answered by multiple people, but it's just this idea: can clinical trials happen without validated biomarkers and outcome measures? Clara, go for it.
I think trials without validated biomarkers or outcome measures is certainly more challenging. Without validated endpoints, it is harder to interpret the trial results, compare the trials, and determine even whether the treatment is working. It can lead to inconclusive results, making it more difficult to move to later phase trials or even secure funding for those trials. Regulatory approval with the FDA will probably also become more complex. And so as they probably usually require quite robust and validated data. So what we're doing with KSOC is very important to help us increase the chances of success in future clinical trials. So thank you so much all if you have already participated.
Thank you. Thank you, Clara. I'm going to switch gears to VUS now, which means variant of unknown significance that we can get in genetic testing reports. This person's asking, we currently have a VUS. How can we test to see if our child has the KS methylation signature? So Dr. Wang, I'll ask you to answer this, and we'll also pop some links in the chat as well.
Yeah, if you have the VUS from the genetic reports and would like to try the DMS signature, you can contact our genetic counselor directly or contact KSOC, and we will need your DNA samples. You can deliver us either frozen blood or the banked DNA from the geneticians who you are visiting. And then we will process the methylation analysis, give you the research reports, what it will look like based on the DNA methylation signature.
Great. Thank you. This next question is for Dr. Simpson. When we look at the muscle tone and coordination symptoms, that can include reaction times, maybe integrating input and output, like the skills we need to drive a car. Does that also include coordinating multiple actions? So I guess they're asking, does muscle tone impact all of these different activities that we might be trying to achieve?
Absolutely. So muscle tone really can impact a wide range of functions, especially too along the lifespan, it changes. So learning to walk is a lot more difficult, as I'm sure many of you have witnessed. And so if your muscle tone is lower, that learning to walk can be more challenging, and so it takes a little bit longer time. And then as you move forward through development, the muscle tone being lower than and typical yes, it can change the way you walk, the way you're coordinated. You may fall more, but also with Kabuki syndrome, we know that where you are oriented in space, and also just orientation of other objects in your space, are interpreted a little differently. So those play a role as well. And so muscle tone, yes, is important, but for coordination, there's a couple other variables. And so given that complexity, we're really wanting to focus to see if we can use what we know to customize an outcome measure for understanding if we are impacting that coordination and that maybe not necessarily muscle tone, but if there's a secondary variable we can impact that will then compensate for your muscle tone. That's kind of the questions that we're asking, if that makes sense.
Great, thank you. Yeah, I think so. And then in the meantime, we know that we don't have treatments yet that are going to target that root cause of the low muscle tone yet. But in the meantime, are there therapies or actions that we can do as parents and adults with Kabuki syndrome? And is there like an age limit on the effectiveness of those therapies? Brittany, I'm going to ask Dr. Simpson to answer this. She also can't give medical advice, of course, but we can talk broadly about therapies that might be applicable today.
Yeah, definitely. So first off, I'm a firm believer in therapy. Therapy is fantastic. I believe many people need therapy for a variety of conditions. And so I myself have recently been in physical therapy. So, there is no age at which physical therapy and other therapies to address certain issues for an individual would not be helpful. So yes, therapies help, and understanding that the therapist, or having a therapist who truly understands not even necessarily Kabuki syndrome, just because a way a therapist approaches an individual is they look to see your function, they look at your body and individualize the program for your body. Though I will say understanding that muscle tone is an impact can be helpful. So no, I don't think that there is a cutoff for age, and I think that it's very individualized what therapy may work for you, given your current concerns or things you'd like to work on. So, and it also could be helpful to have both mind and body therapy as well, because our brains are so powerful. And so, it may be a two-prong approach for individuals to both focus on the body and the mind.
Great. Thank you, Dr. Simpson. This next question is for Dr. Stobaugh. We're going to revisit the clinical management guidelines. The question here is, when they are published, will they be available only to clinicians, or is that something that community members can also have access to?
I think KSF will make that available on their website and all around. And as director of communications, they'll be blasting it and making sure everybody has a copy. So yes, absolutely.
Yeah, 100%. Yes, they are. We have all of this input from these experts that's going to guide these guidelines, but ultimately the idea is that is it a public, open access publication. We want clinicians, researchers, patients, family members to just be so easy to find them because they're going to be so helpful. Dr. Stobaugh, do you want to touch on how they can help newly diagnosed patients and their families? I can think of my personal experience when my daughter was diagnosed. What information was handed to you and was it helpful? If everybody can kind of imagine that, our experience was not great. We got very limited information. It was a list basically of things that could happen and nothing that we could do about them. We just had to wait and see. The clinical management guidelines are basically the opposite of that. And I'll let Dr. Stobaugh take it from there.
Yeah, so I think we all of us who have experience with a loved one with Kabuki syndrome, and understand that it can affect any body system, and also the range of severity is so wide. So how Kabuki syndrome manifests in your loved one, or you as an adult with Kabuki syndrome, is really different from person to person, and so we all want to know what is going to happen, what to expect. And so these kind of things, like having a clinical management guidelines, will help with that. When you do encounter a problem, hey, what can we do about it now? Rather than trying to figure out, well, what is the problem to begin with? So I think a lot of anxiety that comes from not knowing will be known, and as the medical literature also expands, we can also add to it. So, for people who are newly diagnosed, there's a whole list of things that kind of need to be checked, and you have your list of, unfortunately, kind of a list of doctors that you have to go see to make sure there's no heart problems, there's no immune problems, but you'll have an action plan rather than just a piece of paper that says you may or may not have a VUS or a pathogenic variant, and so those kind of things would be really helpful.
Yeah, 100%. And as a rare disease, we're not lucky. I mean, we're making it happen, right? So that we can have this. Not every rare disease, not every disease has clinical management guidelines. That's why it's such a big deal for us to drive the creation of them and support the creation of them with our partners. We are lucky to have what's called a gene reviews publication. So to kind of bridge this gap between not having these management guidelines yet, we have summarized the gene reviews publication into a quick start guide. It is called the Quick Start Guide because it is not the comprehensive clinical management guidelines, but we can also pop that in the chat right now to help bridge this gap while we continue to work on the guidelines. Thank you, Dr. Stobaugh. I'm going to flip back real quick to Dr. Wang and talk about the methylation signatures. We had a family ask if we already have our child's methylation signature information, who can we reach out to have that added to like your database or other databases where it could help support research?
Yes, if you already have the DMS data you want to cooperate, it's great and thanks. You can contact our genetic counselor so you can share the data with us. I think, and also our lab developed the website. This is called Epigene Central. You can also visit and upload it from our website.
Great, thank you so much for that. So we have time for one more question. Again, we are capturing all of your questions and we're going to be able to follow up after the conference with you. And you're also welcome to come to the breakout rooms later where Dr. Simpson will be. I will be there as well. We can probably rope in a couple other folks. So please do join us at those breakout sessions later. I hate picking the last one, guys. Hang on just a second. I want to make sure because I know that you guys are upvoting them as well. If I can't remember if I signed up for a research study, should I sign up again? This is a great one to end on because that's what today is about. Today is about you guys participating in the research, us answering your questions to make it easy for you. And we talked about the burden and how hard it is to reach out sometimes. But if you don't know if you've done it before, yes, please submit your information again. You can also email us. I know some of the forms are very short, very fast. Go ahead and fill those out again. And we have a way internally to check to see if you're doing it for the second time. If, for example, you receive new information about your diagnosis, we also invite you to head back into Kabuki Count, resubmit your information, and we'll update your records as well. That's a great question, and I really appreciate that you guys asked that. Okay, at this time, we are going to close the Q&A. Again, we'll capture all your questions, and I am going to invite our next panelists and speakers on pretty much the highlight of the day, hearing from our adult panelists. Thank you all to all our panelists here.